Dr. Brett Fisher. I'm the Medical Director of the Eye Center of North Florida in Panama City, Florida. And I'm here today at SECO where, along with Dr. Woodard, we've just given a lecture about the future of cataract surgery. One of the specific areas that we discussed during the presentation today was the advent of dropless cataract surgery, where for many of our patients now there is not a need to use antibiotic and steroid eye drops after surgery. The reason for this is that there is now a proprietary compound that we can inject transannually into the anterior vitreous and leave in the eye at the time of surgery, containing 2 antibiotics and a steroid, and that helps the eye heal, prevents infection. Now, a small percentage of patients may need a non-steroidal drop once a day, either because they're at risk for macular edema or because they have some breakthrough inflammation. But for up to 90% of patients, this has really allowed us now to do the surgery and not have to put them on drops afterwards. This has been a real advance in terms of compliance, obviously, because there's nothing patients generally need to use other than maybe artificial tears, or if they're using a non-steroidal once a day, it is much easier to be compliant with that regimen. The patient acceptance has been extremely high. Patients were starting to have a lot of resistance to the expense of the drops that we're using to heal from cataract surgery, as prices have soared recently. Even for generics, things have gotten very expensive, so a lot of patients unable to afford the medications or having other difficulties, this kind of takes that out of the equation. Other patients that just can't really reliably instill drops, they may be have arthritis, they may be nursing home patients, they may be someone where the family looks in on them occasionally but not enough to give them drops, say 3 or 4 times a day. So really it's something that's helped our patients across the board, and we're very excited about it, and I think we're going to be seeing more and more of this as time goes along.